Let's talk about step 4 first, and the Indian variant, or the Delta variant as we now call it. The great unlock is due in just 15 days' time on June the 21st. Is there still nothing in the data to suggest it may need to be delayed?
Well, we're constantly looking at that data, and the truth is that what really, really matters, and what we're really looking at very closely, is the impact of the number of cases that we're seeing at the moment on people going into hospital. And thankfully, the vaccine is clearly having a big downward impact on that, because the majority of people, for instance, in Bolton Hospital, on the latest data, the majority of people are unvaccinated people. And that's because the vaccine is our route out. We have to see exactly how effective it's being, and that's what we'll be looking at over the week ahead, along with all the other data.
Understood. My question, of course, was what the Prime Minister said. There's nothing in the data so far suggests we need to delay. It's interesting you didn't repeat his practice ad hominem now.
Well, there isn't anything in the data that makes it definitive that we must stop and not do the 21st of June. There isn't anything in the data that means that we definitely can't do the 21st of June. But as we've said all along, we're going to look at all of the data over the next week, and then give people time ahead of the 21st. Once we've made the decision with the most information that we possibly can.
All right. Public Health England caused some concern last week when it announced it discovered early evidence suggests there may be increased risk of hospitalisation from the Delta or Indian variant. What more can you tell us about that now, if hospitalisations are going up from the Indian variant?
Well, I'm glad to say that at the moment the number of hospitalizations is essentially flat. Now, of course, we're constantly vigilant to that, and I look at it every day. But the number is essentially flat. This data is early data. It doesn't. We haven't come to a conclusive view that more people end up in hospital as a result of catching the Delta variant than the previous dominant Alpha variant. But we publish the data all the time. So even when there isn't a strong signal, and we can't say that with confidence, we nevertheless tell everybody the latest we've got. In fact, one of the things we've got used to over the last year and a half is being able to have a high quality discussion about where there's uncertainty, which is obviously very important in the pandemic.
No, absolutely. And I'm sure the British public understand that by now. But at every step of this pandemic, I think history will prove, and the facts have probably proved, that it has paid to be cautious, to give a little bit more time. If in doubt, and I think you're being honest to admit the government still very much is in doubt, and we can't blame you because there's so much still unknown about this. Just delay a little bit, just to be on the safe side. Surely that would be the most obvious thing to do here.
Well, you're right that the whole approach is cautious, and the goal is that it's irreversible. We set that out when we set out the roadmap. So you're right on the caution. The question really is how cautious. We were careful in the run up to step 3, and we took the decision to go ahead. And I think, with hindsight, that was the right decision. And so you need caution. But not an abundance of caution, because we all want to get back to normal and get back to the things that we love. So you've got to get the right degree of caution, if you like. That ultimately is the judgment.
Not too cautious, not too uncautious. Tricky. Let me put you this: some newspapers, some prominent, large circulation newspapers in this country, are campaigning pretty vigorously for you to go ahead with June 21st. The great unlock must stay in place, but 2 polls in the last 2 days, one in the newspaper this morning, one in the Times yesterday, actually show the public support a far more cautious approach. In fact, this poll in the Times yesterday showed that the majority want social distancing to continue in places like pubs and restaurants beyond June the 21st by 61% to 30%. Do you find that in your experience, the British public is actually, no matter what some newspapers might say, erring towards that caution?
Well, there's no doubt that the public have been absolutely brilliant at understanding the need for the rules and to follow the rules throughout this, and that has been one of the things that's helped us as a nation to get through it. Is that, despite the fact, of course, there's always some both voices and people who don't want to follow the rules, and very small numbers who complain and protest and all the rest of it. Actually, that isn't what Britain thinks. What Britain thinks is we need to get through this together. And I certainly, I find that important and helpful, because after all, this isn't something that, I do talking to medical advisors and with Boris's leadership. It is something that we all do together, following these rules. And the vast majority of the public follow them, and want us, as a nation, to do this carefully and cautiously. Now, what I'd say about the next step is, we we'll take it if it's safe to do that, and I am absolutely certain that whatever decision we take, the public will. We'll get that. This is a tricky call. So one other thing that's worth saying, which is that, there are, alongside the decisions that are within step 4, there are also reviews on things like social distancing that you mentioned, and we obviously need to be clear about our conclusions of those as well.
Well, let's get to those. I just want to see quickly the Nepal mutation to the Indian variant, which emerged this week, and the Transport Secretary spoke about that when you took Portugal off the green list onto the amber list. What more can you tell us about that? And Chris, have you found any cases of the Nepal mutation in the UK yet?
We haven't yet, and frankly, I want to keep it that way. These variants start off as things that we have a high degree of uncertainty about, and then we get more certainty about them as we can study them more, as the scientists at Porton-Down, at Collingdale, and elsewhere do their work to understand these variants more, and we take the precautionary approach. As per our previous conversation, that I'm cautious on international travel, and it was great to have Portugal on the green list, and it was I was very sad to have to recommend that it came off. But
to overrule the Transport Secretary, and what we read this morning was a furious row.
Well, I'm not sure about that, and I think he said the same. Of course, you have to. We discuss these things and then we make a decision, and that's what happens. He and I get on very well and work incredibly closely together.
Okay, let's move on to vaccinating children, or to be precise, 12 to 17-year-olds. Obviously, Pfizer was cleared as safe to do that if the government so chooses. And the JCVI, who you've tasked to look at this, they have been also extremely clear that they can give you some advice, clinical advice, but it really is for ministers to make this decision whether to vaccinate 12-year-olds and above, because it's a really complex ethical question. So when do you, as ministers, expect to do that, to make that decision? Before the summer holidays start, for example?
I'd expect that decision to come to us in the next few weeks. You're right that it's ultimately a ministerial call. These big decisions are, but we are guided by the clinical evidence and the clinical advice, especially on vaccines. And we want to make sure that parents are assured and confident that the decisions that we're taking are ones that are advised by clinicians. Quite right. But there are a broad range of considerations you've got to take into account. The fact that the number one epidemiological reason, if you like, to vaccinate children is to reduce the risk of transmission to others. But there are direct benefits as well. Children can suffer from long COVID, and also we want to protect education. And when children get COVID and get test positive, their whole bubble often then has to isolate, and so you damage education for a large number of children. So that is not a clinical reason, if you like, but it is a reason that needs to be taken into account in this decision. There's a broad range of things that we'll look at. I'm really pleased that the regulators have found that the jab is safe and is effective for children. We've bought enough of it in case we were going to make this decision, so we're ready for it. And we'll be taking the decision in the next few weeks. I haven't seen the JCVI's advice yet.
Sure. It does rather feel that you're leaning into vaccinating children. I know you haven't made that decision yet. I heard your words elsewhere on broadcast this morning. You do seem rather keen on the idea. Can I just put to you an incredibly primitive straw poll? of a barbecue I went to last night where all four mums there were really nervous about this. All four mums have got kids in that age group, 12 to 17, and they're really uncomfortable. It suggests to me that if my West Sussex barbecue straw poll is anything to go by, you've got a persuasion job on your hands if you want to go ahead with this, because as it's also been pointed out by clinicians, one child's death, which would be an appalling tragedy, obviously, and no one's saying that would happen, but if that did happen, you'd set the entire vaccine rollout program back hugely. Vaccine hesitancy would rocket. So is it really something you're prepared to persuade parents that it's a wise thing to do?
Well, of course, we are not going to make this mandatory. Of course, we're not. So parents can have their views, but we have seen now that we've delivered 40 million vaccines. So we can see the safety of the vaccine at a very, very large scale. And then there've been clinical trials now specifically on children. And so we do have a huge amount of data on which the safety of the vaccine can be judged. And I think people will have seen that where we don't think a vaccine is applicable for a certain age group, or even where we think it's not the best for a certain age group, then we're prepared to recommend that we use a different one, and that's why we use the Pfizer jab for under 40s. So, we are really careful about this. We're not going to make it mandatory, but it does have benefits, but that's another reason why I'm careful to ensure that this is clinically advised and we go on the basis of clinical advice rather than purely the ministers making the decision.
Understood. As interesting, you said it won't be mandatory for children, so there'll be no question of children being excluded from school if their parents decide it's not right for them to have the jab.
Well, we're not taking a mandatory approach. We are saying that there are certain areas that if you work in, for instance, in social care, in a care home, then we are looking at whether you should be required.
Sure, but will children be excluded from schools if they don't have the jab?
Well, there's nobody suggesting that. This is about reducing transmission and protecting education in the same way that, all school children, secondary school age children this evening should be taking a test. Now, they're not mandatory, but everybody does it because it's the right thing to do.
Okay, let's move on to an announcement the Prime Minister has made this morning in the upcoming G7 to vaccinate the world by the end of next year. He wants the G7 to commit to that now. Donating money and know-how is great, and we know the British government has done that with the AstraZeneca vaccine at cost to the rest of the world. But actually donating vaccine supply, which the White House is doing this month, has begun doing, actual doses, is the most immediate way any government can help. We spoke to the World Health Organization's Special Envoy for Vaccines, Carl Bildt, last week on this programme. Let me just play a very quick clip of what he said on that.
If we take the choice between allocating scarce vaccine doses to, say, young, very healthy, very young people in, say, the US or Sweden or UK, and vaccinating health workers in Africa, I would allocate those vaccine doses to the health workers in Africa. I mean, apart from the moral aspect of it, the moral responsibility that we have, if you want to have a global leadership position for what's happening in other parts of the world, pure self-interest. As I said, with the pandemic raging in wherever we talked about, India or Brazil or Nigeria or whatever, the new variants will appear.
Okay, so that was Carl Bildt, and you heard his argument there very clearly, which is the people who need these vaccine doses now are not young, healthy British adults. They may not be young, healthy British children. They're health workers in Africa, where 2.5% of the entire continent has had a vaccine so far. So when are you going to actually start donating doses, not just talk about grand projects?
Well, we are already delivering 500 million doses already delivered, already being supplied.
That's not part of our vaccine
around
supply, though, is it? You know what I'm saying?
Yes, it is. Yes, it is.
Doses that we have in this country that we're now going to give to Africa or wherever it may be needed.
Well, it doesn't matter where a dose is manufactured, so long as it's manufactured to high quality. 500 million, Tom. I mean, 500 million doses have been supplied around the world at cost, thanks to the work that we've done in this country. We should be really proud of that. And it is that approach which will be at the mainstay of this leadership the Prime Minister has shown in calling for the G7 as a whole to ensure that we vaccinate the whole world by the end of next year. What matters is outcomes. What matters is getting jabs in arms. And whether that's a jab that is technically owned by the UK government on contract and we then pass over. And when we have excess doses, we will do that, but we don't yet have excess doses. Whether it's that route or whether it's what is currently the much bigger route, which is getting the technology, getting the doses manufactured at cost in country, not charging for the intellectual property. 500 million of the world's 2 billion doses delivered so far have been the Oxford AstraZeneca vaccine delivered at cost. And I'm delighted that last month Pfizer have now come to the table saying in low income countries, they too will do this at cost. This is how we get the big numbers. And of course, I don't rule out giving actual doses when we have.
So my question is when?
Great.
When are you going to do that? And when are you going to announce it? This week?
Well,
Prime Minister's got more to say on this?
Well, as and when we have excess doses, we will be able to do that. But I think the thing that I'm reacting most strongly against is the supposition in your question, which is fundamentally flawed, that unless it is a dose that comes physically through the UK, it isn't a UK contribution to the global effort. That is entirely wrong. And it is not only sort of wrong in terms of how we describe what we're doing, it's also that the big numbers come from the getting this jab done elsewhere, as well, of course, as coming to the table when we have when there are excess doses that we can promise.
Jack's got a couple of quick questions for you.
Hello, Secretary of State. I want to bring you back to domestic matters. I interviewed your Conservative Party colleague, Owen Paterson, for my podcast this week, and he spoke very movingly about the death of his wife, Rose, who, as I'm sure you know, took her own life last year. And he's desperately worried that 18 months of lockdowns is going to trigger a mental health crisis in this country, the like of which we haven't seen for many generations. I know he's spoken to you about this as well. Do you share his fear of a sort of delayed mental health crisis, and what can we do to tackle it?
Well, I do worry about this, and I saw the I saw the podcast. I haven't been able to listen to the whole thing yet, and obviously I know Owen well, and I knew Rose very well. I worked very closely with her, and in the past, and I think he's right to highlight this. Now, we've got to put in the resource. We've got to put in the money into the NHS, and we're doing that. But there's something more broad than that Owen is calling for, which is for people to look out for each other's mental health, for us all to think about it proactively in the same way that you think physically about keeping yourself fit physically, and of course the two are interrelated as well. And for using the resources that we have better, and better targeted, better use of data, for instance, and so that we can recover from this as a nation.
And just finally, you're before the Commons Health and Science Joint Committees imminently, the same committees where your former government colleague Dominic Cummings was appearing just a few days ago and giving such explosive testimony about you. Are you looking forward to the chance to set the record straight?
Well, I'll just be answering the questions as fully as possible, and explaining what we did at the time.
Won't you be out for revenge?
Certainly not. I'm interested in how we get this country out of this pandemic, how we prepare so the world is better placed not to go into future pandemics, how we learn the lessons, of course, of what happened in the past. But that's best done on the basis of sober concern and looking carefully at what was done based on all the information that we now have that we didn't have at the time. And I think that is the appropriate way to address this rather than baseless accusations.
Health Secretary, thanks so much for your time. Finally, before you go, any chance of a deal with the rebels tomorrow to climb down, to change your mind and reimpose the 0.7% aid spending commitment for next year?
Well, I think the government's position on this is entirely reasonable, given the once in several centuries scale of the economic challenge the hundreds of billions of pounds that it's cost to fight COVID, both in terms of extra money into the NHS and other areas, and furlough, of course, and the lost economic output and tax revenue. So it is a huge challenge. And anyway, coming back to what we were talking about at the start, what is the best thing that Britain can do for the world over the next year and a half before the end of next year? It's get the world vaccinating, and the Prime Minister's leadership is going to help to deliver that.